We look at what's the material that we want, what's the shape that we want, and what's the texture. There are some women who feel more comfortable with saline and some women who feel more comfortable with silicone. Certainly there's benefits to each and downsides to each. Saline is a firmer implant, and by how it's designed, there's the possibility of wrinkling and rippling, and it tends to be around the outside and perimeter of the implant. And so in a really thin woman who leans forward, perhaps, you can see it on the inside and the outside of her breast where you see little scallops. And so for a lot of women, they don't want to see that. But if you're looking for a very full breast that's very, very firm, then saline can offer that because you can adjust the volume to give you your firmness. On the other hand, with silicone, if you want a really soft breast, silicone more closely replicates the feel of breast tissue. So first we talk about what the material is. What's the inside? What does it feel like? The next thing that we look at is shape. What is the shape that we're trying to create? And there's basically two shapes available. We have what are called round implants and anatomic implants. And anatomic is basically a teardrop shape. And even within anatomics, there's varying heights and varying projections. And so there's so many choices, and we can really begin to narrow in and tailor shapes for patients depending on what they're looking for. The round shape is going to give a much fuller lower base of the breast, and it's not going to have as much fullness up high. With an anatomic implant, you can vary that because there are low height, medium height, and a tall height, so you can get a higher shape to fill in. Oftentimes we struggle with a concavity up here. You can fill that up as much or as little depending on the shape of the implant that you choose. On the other hand, you don't get as much fullness down low. You can still have a very full, shapely breast, but it's not going to be as full and round compared to a round implant. And so really, it's trying to tease out what's the shape that you really want, and it's the shape of the implant that really will help us give you the shape that you're looking for. Certainly volume plays a big role in that, and so certainly the bigger volume that you put in that area, the fuller the breast will be, and of course the smaller that you do, the smaller it will be. And so then that really becomes personal preference. Once we have our material chosen and we have our shape, the next is textured versus smooth. And so it really depends on if you want a mobile breast or if you want an implant that is staying in place. And so a smooth implant has a lot more mobility, and some people really like that. And some people don't like that. So it depends on what you're looking for. If you have a very mobile breast, you may say, I don't want my breast to move as much. Or if you haven't had very much breast tissue at all and you've never had movement, you may decide that, I think I do want more motion. And so really it's a feel and emotion. The important thing to realize is with a textured implant, you're not going to have motion. And with an anatomic implant, we have to have a texture outside as opposed to a smooth. With a round implant, if it's smooth and it spins, it continues that circular shape, and so you can't tell. But if you have a teardrop shape and it rotates, that's not something you want to see, and that's called a malrotation. And so we have to put a textured outside to that implant to prevent it from spinning.